going to get really precise. So we're not looking at the number on a scale. We're not really looking at our waist circumference. What we're looking at are very typical, for the most part, blood tests that your doctor will order. But I have a couple of them highlighted here. And the reason I have them highlighted, which is fasting insulin and vitamin D, is because your doctor won't order those naturally. You need to ask them to include that on your annual exam. Why? 2 reasons. Vitamin D is a really strong indicator of where your immune health is, whether or not your mood is going to be stable. And it also helps with blood sugar regulation and thyroid health, as well as other things in the body. Vitamin D is kind of your Wi-Fi, and it's the precursor to all of your hormones, to testosterone and estrogen and all of those other things. So we know there's a lot of literature around your vitamin D levels. So you need to ask your doctor. And what we want the level to be is close to 60. So keep that in mind. They'll tell you 30 is enough, but you don't want just enough to get by. You want to optimize it. And the literature is pretty strong, hashtag COVID, around the serum level being 60 or better. And I don't have a single patient that doesn't need to address this, that doesn't need to supplement significantly in some way. And you don't know unless you test. So the other highlighted test that I want to talk about is fasting insulin. Many times you'll see the test above that says fasting blood sugar. Every doctor will measure that, but that is a very late measure of your health. You want to know where your insulin is, because that is going to be a bigger predictor of early identification of health problems. By the time your blood sugar is high, you're way down the road in terms of developing chronic health problems. And hemoglobin A1C, that, if you've ever heard of that, it's abbreviated HA1C. Your doctor may or may not order that. That is a measure of how much sugar has been in your bloodstream for the last 3 months. So it kind of evaluates not only your diet, but also how well blood sugar is being cleared from the bloodstream. You're getting a picture here that your blood sugar matters more than your weight. Yeah. So there's other things, liver enzymes, thyroid function. Those are more typical, but you'll notice in the parentheses that thyroid is more than something called TSH. You need to also tell your doctor you want the other things measured, free T3 and free T4. Now, the last thing I want to talk about on this page is this fasting lipid panel. Your doctor will measure this, but they're going to focus on total cholesterol. It's not really that relevant. The key thing about cholesterol is you want it above 150. Absolutely. Now, they're going to tell you they want it below 150, but I will tell you will have mood issues and other functioning problems when it's below 150. And I like it much higher than that. I'm more interested in your triglycerides. So the key thing you want to be paying attention to is triglycerides. Now, this is where the myth starts, is that fat will make you fat, because a triglyceride is a lipid or a fat. But when you're measuring fasting triglycerides in a human being, it reflects your carbohydrate intake. It's all about your blood sugar. So you want that less than 150, and ideally, I'd like to see patients at 75. And there's a way to do that, but we won't cover that tonight. But these are all blood tests that you need to expect to get from your doctor and ask for the results. Don't just accept that, oh, it's now sitting in my chart. But the ones that are bolded, you need to specifically ask for. And optionally, there's one below the fasting insulin called ApoB. That is going to give you your cardiovascular risk, much more than total cholesterol. Most people entering the hospital with a heart attack have normal cholesterol. It's what it's made up of that matters. Anybody have questions